Good afternoon. Thank you for joining us. My name is Kelle Shanks and I'm with Convergint Technologies. I'm going to be your moderator for today's webinar entitled Workforce's Return to a Post-COVID-19 Environment. Our panelists today are Mike Kuhn, Vice President of Business Development for Convergint, as well as Doug Greenwald with our Advanced Solutions Group. We'd like to make this webinar as interactive as possible. So please go to the button that says Show Q&A. Put your questions there that you would like asked. I'm going to monitor them and get them in front of our panelists. To kick things off, I do have a couple of questions. So I'll start with Mike Kuhn. Mike, based on feedback from your customers, what does the new normal look like in their buildings?
Thanks, Kelle. And thanks everybody for joining. We really appreciate your attendance today. Hopefully we have some good information that you can carry forward and apply to your facilities. Kelle, what's the new normal going to look like? Well, I think you have to look at that in really two different segments. You have to look at it both in the short term and you have to look at it for the long term. In the short term, I think buildings based on their local authorities having jurisdiction will be constrained a bit as far as their overall occupancy. And that's going to be something that will fall upon the building to track and maintain records as to the number of individuals that they have within the building. So it'll be important that through the systems you currently have or potential systems that you would add, you need to come up with a strategy as to how you're going to track the overall occupancy based on what you're allowed to have back in the building. The next thing is, I think as you start to reopen your facilities, it will be important for you to understand how people are going to enter the building and what type of occupancy controls or entrance strategies you may put in place to make sure that you're safely bringing individuals into your facility on a daily basis. The entrance strategy really should look at three different things. Who is coming into the building? When are they allowed into the building? And what entrances are they supposed to use as they enter the building so that you can potentially do any type of screening that is required, whether that's giving them some type of health screen or could wind up requiring you to even take an individual's temperature as they enter into the building. And Doug's going to talk to you a little bit later about some of the technologies that Convergint has been working with to do that. The next thing that you really want to take a look at is how are you going to potentially track and or trace individuals as they come into your facility to basically have the ability to be able to go back and look at an individual that could possibly be infected as to where they've traveled and who's been around them at any particular time. And we'll talk a little bit later about a tool that Convergint has developed with one of our partners to do exactly that in a simple report that gives you the ability to track an individual based on their ID credentials as they come in. The second thing, the next thing I would really take a look at is making sure that you have secured all areas of the building and you've done things properly to segregate different groups of your work team so that you don't necessarily have cross-contamination between, let's say, upper management and the general population of the facilities. All of you have existing, potentially existing access control systems that can be modified to do just that. But now is the time short term to implement those strategies and in turn wind up testing them to make sure that they work properly based on those policies and procedures you put in place. The other thing I would recommend is testing some type of lockdown or emergency management procedures that you may have. not only for the COVID issues, but also for the, we're experiencing obviously some levels of civil unrest. And I think it's important that you understand how your system works and how you can very, very quickly, almost on an immediate basis, make those changes to your system so that you can protect not only your facility, but also you can protect those occupants that are in your building. Kelly?
All right, great. Thank you, Mike. Doug, based on the technology that Mike touched on, could you tell us what some of the hottest trends that you're seeing out there?
Absolutely, Kelle. And Mike addressed a handful of things that align very closely to technology that we've been working on from an advanced solutions perspective, as well as what we're seeing has been top of mind for a lot of these companies. And no doubt, I think the first thing that comes to mind for many folks are thermal cameras. And those are certainly an important topic. And even some states now are requiring temperature checks for employees as they go back to work. I have no doubt we're going to get into more around thermal cameras here in this hour, but I do want to take a moment and talk about more of the emerging technologies, some of the integrations, software updates, and unique applications that we're bringing to market to support our customers. And really the hope here is that we can provide tools that provide some level of deterrence, right? When we think about the way we've done business in the past, I know many of us have gone to work sick. And so kind of the new normal, the idea is we want to deter those people from making that choice in the future. In addition, we want to kind of detect people that may have come into the environment that aren't following new guidelines, and as well as we want to empower companies with the ability to respond to those incidents to promote that safe work environment. So let's start with deterrence. What are we seeing out there? Yep, thermal cameras, which I do believe kind of fall into the form of deterrent side of things. We're seeing a lot of our visitor management partners updating their software to do a few key things that I think are really important outside of just your employee base. For example, new screening questions for visitors and contractors to identify if they may be a risk being introduced into the facility. Some of the software can now help also control the number of visitors that can be registered for a particular day within the software, to keep those capacity restrictions that Mike was mentioning in mind, so as not to overbook non-employees coming to the facility. And of course, we are seeing a lot of these visitor kiosks now be integrated with temperature taking devices, which can then provide that next layer of screening within one solution. So that form of kind of deterrence as well as screening from a visitor management perspective has been getting a pretty significant facelift here in recent weeks and months. Another form of deterrent that we've been seeing is more of a proactive screening approach for employees away from the office to determine if they're fit for duty. In response to some of our customers having a challenge in identifying how they're going to reorganize their lobbies for some of this go back to work requirements, we've identified and developed a workforce tracking application that provides companies accurate real-time information on the health status and availability of employees. It's a SaaS offering, simply requires employees to download the app from Apple or Google Play and register to begin reporting their status. And essentially what it entails is a brief survey within the app, helps the employee do some self-assessment through a series of questions. And then they could also potentially, depending on what lengths the employer wants to take, have the employee take a self-temperature from home and upload those results to confirm that as of the time of that, there's no symptoms of a potential virus or infection. If they come to the office and they're approved to work prior via this application, they get a green QR code that they can present upon entry. If they're not only is notification given to them as well as their management, but they're given a red QR code. So if they did try to come to work for that day, they would not be able to bypass. And all of this can be integrated into the access control system. So taking a further step of being able to disable access for that employee if they were to fail the survey. And so that tracking app is just one small component of an overall enterprise-wide fusion platform that we've been developing and working hand in hand that can integrate all safety, security, and operational applications and data sources into this one single interface. So it's a great jumping off point for companies looking for kind of that single point source of truth across their organization. So as we move,
Doug,
yeah,
what
go
is
ahead.
the name of that application that you're discussing right there?
Yep. So we rebranded it from a Convergint perspective, but it's called Octopus, and it's providing a really great resource for folks looking to kind of have that self-service key application capability for employees from afar. So that handles kind of the deterrent side. From a detection perspective, it's coming in a few different forms. Primarily what we're seeing are analytics being overlaid to existing video surveillance platforms that can identify a couple of key areas. One would be social distancing, or the opportunity for the lack thereof as people start to come back to work. And really the goal here isn't for the system to identify, a CEO and CTO having a discussion in the hallway, but really the goal here is to identify what areas of the facility could benefit from additional reorganization or additional signage that discourages congregation. And so the overlay for social distancing can prove valuable in the fact that, one, helps us make employees more aware of that concept. Even if people have passed screening, we still want to take that into consideration. But in addition to that, we're also seeing, as Mike mentioned, the need to stay within capacity requirements. So people counting is another component that, again, if we can overlay it with your existing systems in place, so you don't have to go out and add a whole bunch more new cameras or even facelift your existing VMS, the overlay can allow counting of people as they enter and leave, and also identify if they're wearing a mask. So if that's a requirement of the business, they may want to be notified if somebody enters into the facility not adhering to that requirement. The nice thing about these overlays is they're relatively easy to deploy and cost effective. So you can kind of address a couple of key areas with your existing infrastructure. Now, as Mike mentioned, another interesting thing is the response side of it. And if you've been able to run into somebody that, from a COVID perspective, there was a confirmed case at your facility, we've got a unique application we've been able to deploy in partnership with a company called Detrios, is the ability to perform contact tracing, leveraging your existing access control system. It's platform agnostic, which is great. You can deploy it in a very short period of time. And if you're not familiar with the term contract tracing, it's essentially the process of identifying persons that may have come into contact with an infected person. So once a case of COVID-19 is confirmed, system administrators can leverage the card reader history to provide data about not just the infected person, but also their interactions. So for example, Kelly, you were asymptomatic. You went to work unaware of having an infection, but developed a fever the following day. So you stayed home. You eventually learned you had COVID-19, notified your work, who in turn likely notified health officials. Using your card access history and identifying specific timeframes, right? That's pretty easy today with most access control platforms. But what is not easy, and what this application empowers you the ability to do now, is to quickly identify the other card holders who are in close proximity of your entries through those doors. So this can help identify other potential exposures, help minimize spread, and maintain operations. So this is a key example of kind of the response companies can have available to them at their fingertips, again, with their existing systems if this situation arises. So hopefully that's a lot of information there, but hopefully a good brief on some of the pending and new technologies we've seen impact the workplace.
Yeah, that's great, Doug. Thank you. One of the questions that came up from the audience, which I think both you and Mike can address, is how are people addressing the privacy and health regulation compliance with clients, not necessarily employees, but clients as part of this solution? Because there's always that privacy issue, right? So how are we going to mitigate that?
Yeah, great question. I guess I can jump on it first here, and then I'll let you, Mike, jump in. But the way we look at it today is a lot of the employer-employee relationship is governed via EEOC, ADA, and OSHA. And so let's address temperature taking, since that's the most obvious one that's happening today that's outside the normal. So the way those organizations look at it is, when there's no pandemic declared, taking an employee's temperature is considered a medical exam and is therefore prohibited. So in cases where a pandemic has been declared, and these websites provide tremendous resources under each one of those agencies as to what screening questions are acceptable with a pandemic in place, that the temperature of an employee can be taken given the circumstances of today. What I think will be really interesting is when the pandemic is lifted, will there be sweeping changes allowing for this to be the new normal, or will all of this revert back to the original kind of EOC, ADA, OSHA guidelines that prohibit this? Now, from a privacy perspective, when you enter onto private property, it is up to the business, whether that's the real estate side of it or the person that's leasing that space, to determine what's acceptable, if that's wearing masks when you come back in, or if you need to have your temperature taken to be on that property. So that's a very different conversation than the employer-employee relationship, where now as a private business, I can dictate what happens on my property for anybody to come on. It's no different than probably what we're going to see with maybe Disney or Universal. If you're buying a ticket to come on property, there's probably going to be some type of screening required of you to get onto the premises. So I think what's important here is that businesses can decide outside of the employee relationship how they want to approach screening individuals and what that looks like. Mike, I'll turn it over to you.
Mike,
I think you did a great job there, Doug. I'll let Kelly move on with the next question. Good answer.
So Mike, give me an idea of some of the things that will definitely look different as clients open their facilities and move to full capacity.
Well, I think over the past couple of months, the key recommendation that I've been giving to the clients that I speak with on a daily basis is to first and foremost evaluate what you currently have. Evaluate the systems that you currently have, evaluate the policies and procedures you currently have, and make sure those two mesh together effectively. And really take a hard look at everyone that's on this call from a customer side of it has probably made some investment in physical security infrastructure to their facilities. When you installed those systems, chances are they were installed with a lot of leniency as far as who can go into the building, when they can go into the building, and what needs to be done once they enter the facility. So it's important to take a look at how your systems are programmed and make sure that you've changed how they're programmed to meet those new policies and procedures. I can give you an example of that. One of the customers that I talked to early on, back in the late March, early April timeframe, a large customer that has over 10,000 cardholders that report to a single building on a daily basis. And he asked me, he said, Mike, what would be your recommendation on what I should do? And I told him that first thing they should do is go back and look at their card record holder database and see how you've segmented or separated that database so that you can very quickly turn on and off access to large groups of people with really just the click of one button versus having to go into your systems and make multiple changes. That can be a very, very effective tool for you as far as if you do have an emergency or somebody is infected in a specific area, before the situation gets worse, you can basically close that area off so that nobody else can get in there. The other thing is look at your entire database for who's on there. There are a lot of people that are probably within those large databases that you have for access control that may or may not even work for the companies that are in a multi-tenant facility, or they could be contractors that you use to do services in your building. You have to go back and re-verify every one of those individuals to make sure that they're recertified to be in your facility, and at the same time communicate to them what the new rules are as far as entering your building. The other thing is, when you do take a look at that the database, you want to take a look at any people that are potentially furloughed or have been let go during the pandemic, that you're removing those individuals from the database, because it will just make your overall reporting and what you're doing based on your total card record holder population versus the people you have in your building. It will make it much, much clearer as to how many individuals you potentially have in there as far as occupancy. My recommendation to every customer is that you've made significant investments in what you currently have, and the way it was programmed in the beginning may not necessarily be the way it needs to be programmed today to meet the new requirements you have. So we can make those changes, or your integrator can make those changes for you right now, so that you're prepared once you do wind up even letting a small population back into your facility, and letting those individuals know exactly what the new rules are as far as how they can move about the facility at the same time.
Oh, Kelly, we can't hear you.
Mike, thank you. We've actually had a question along those lines about contact tracing within the facility come in from the audience. And the question is this: for the contact tracing piece, looking at other card holders who use the same entry-exit point is one thing, but how would you know who is potentially infected person also came in proximity with in other areas of the facility? For example, away from egress and ingress points. So more within the confines of the building, not just entry and exit.
Doug, why don't I let you answer that as far as the CERT tool is concerned?
Yeah, so the CERT tool very much, and the one I just talked about, very much focuses on entry and exit. So there are a couple of other technologies available to us that we're actually in the process of researching right now. Now, one that's been pretty well established is real-time location services. So being able to provide your employees with some type of lanyard or credential that allows for tracking within the facility. That would then allow you to kind of identify where, again, congregation may be occurring, and also be able to go back and look at the path an individual took throughout the facility based on those real-time location services. Another technology that we're looking at is UHF embedded in a credential that could also provide that same monitoring of individuals and tie it to the credential. Now, again, we don't want to get overly to Big Brother from that perspective, but given the circumstances from a COVID perspective, but this provides that additional peace of mind, and your business does have a higher level of proximity in terms of individuals. I know there's a lot of manufacturing, distribution locations, essential workers that do have to work within close proximity. So being able to kind of track those movements and identify if you do have somebody that potentially that is confirmed COVID and potentially was around others, that is an option that could be available to you, is one of those two.
Okay, great. Thank you. What about, is it possible to use facial recognition for contact tracing?
From a video surveillance perspective, yes, we've looked at a couple of options in the space. I won't call it manufacturers by name, but there are a couple that are doing that, where you can track an individual from camera to camera based on, the information of that individual. So there are some options, again, leveraging your existing infrastructure, doing that overlay, and identifying their movement throughout the facility. But again, the limitation there is if you don't have a lot of interior cameras, which most folks do not, simply from a privacy standpoint as well, and you potentially only have cameras on the exterior or major areas of the facility, you could be missing places that they traverse. So Just something to think about. Is your camera coverage adequate enough to leverage an overlay like that in that capacity?
All right, great. Mike, going back a little bit to one of the first questions we had from the audience in reference to protecting the organization from clients, not necessarily employees, how can organizations protect themselves as we begin reentry?
Well, I think that one of the key things that people can start looking at is what are their entrance control strategies. I had one client very early on. I remember when the system was installed in this building, and it's a very, very large lobby that they have with 11 entrances. And one of the new strategies is that they're only going to allow building occupants and the clients or visitors that they have to enter in through 3 doors that they have in the main portion of the lobby. That way, as they start to develop their strategy for screening and testing, they have the ability to control where those people are entering the facility. It's very, very apparent that when we first installed these systems, we made those systems work based on a convenience basis. So we let people really come into the building from any entrance that was available that had a card reader on it. And now I think one of the biggest things that will change is that customers are going to have to take a good hard look at what is the best entrance strategy they have. And once that entrance strategy is established, you'll be able to start to look at some of the screening technologies that Doug talked about earlier, because a lot of those screening technologies are heavily dependent on the overall environment that is in that particular lobby or entrance, especially when you get down to things like thermal camera testing of temperatures. You need to make sure that the individuals are entering a space that is relatively consistent as far as the ambient temperature of that room. The other thing is, when you look at what you're doing with your current systems, I think it's very important to look at the reporting horsepower that you probably have within your system, but you really haven't had to use it in the past. And it's important to understand that there are a lot of different technologies that we can overlay on your current access control database to allow you to slice and dice, even down to the reader level, how many people you have going through a certain area on a daily basis. And that may determine, based on social distancing, as far as the traffic flow you have on a specific reader, how you're going to change that strategy so that you prevent people from being congregated or together in areas where you want to try to maintain that overall social distancing.
All right, very good. Thank you. Doug, I'd like to go back to thermal cameras because that seems to be the most popular item asked for these days. And there's a lot of discussion about those cameras. Can you walk us through the technology and the accuracy of some systems versus the cost?
Sure, absolutely. So there's a ton of information out there on this topic, and one resource I want to make sure everybody on this call makes sure they read through is on the FDA website. I'm going to look at it right now. FDA.gov/medical devices. You can navigate to where they specifically address thermal imaging systems, and the content was updated in May. So just a couple weeks ago. And it specifically walks through a ton of considerations. More importantly, what some of those limitations are, as well as how do you prepare the area to begin performing evaluations. So I think there's enough resources out there at this point that kind of level sets the capabilities of this technology. And so the way we're looking at it is, I wouldn't say accuracy and cost go hand in hand necessarily. In fact, I would almost kind of put accuracy to the side for a moment and promote consistency above and beyond, regardless of what you spend on your system. And here's why. If the camera can measure a temperature down to 0.3 degrees Celsius, that's great. But don't confuse that accuracy claim with being able to measure within 0.3 degrees Celsius someone's core body temperature to determine if they have a fever. These systems are able to take skin temperature, and even when evaluating the inner canthus of the eye, there can still be factors that affect the measurements, as these are not invasive medical exams. So I would really encourage everybody to take a look at what the FDA has published around this, especially the guidelines. They make some very specific comments in regards to mass screening systems and the challenge for some of the viability of measuring people at multiple different distances. Again, from a consistency perspective, Mike hit it pretty clearly. When you bring people into your facility, it's got to be reorganized, almost like a TSA screening checkpoint, so that people have time to acclimate their skin temperature to that ambient environment. If you're in an area that it's highly humid and really hot, and you start to present people right in front of these systems, as soon as they enter into the facility, everyone's going to be elevated. There are going to be a lot of false positives. So this is a great resource. Make sure the location of the camera is appropriate. People remove their hats upon entry, right? A hat, some type of head covering is going to capture heat against it. So when they step in that front of that camera, it's going to be elevated. And then the other thing is, if the system, and again, make sure you clarify when you're doing your evaluation, is the system taking a measurement of the forehead, skin temperature, or the inner canthus? If it's the inner eye, everyone stepping in front of that camera needs to remove their glasses. And these cameras cannot see through any type of window, sunglasses, any type of lens other than the germanium lens that's covering the camera components, or else it just doesn't get any type of measurement and reading. So that's an important part of the process. And one key takeaway, right, and again, aligning with the FDA here, measure only one person's surface skin temperature at a time. And if you can, the image area should include as much of that person's whole face as possible and calibrate it against a black body to help improve that accuracy. So let's just make sure that we're coming to the conversation about these cameras grounded in the fact that they're not going to be correlated entirely to core body temperature. It is surface skin temperature. And the goal is, if you have a consistent process, you're measuring everybody in the same way, they have the same amount of time to acclimate and measured at the same distance over and over again, that provides that consistency to find the outliers within those measurements to then perform secondary screening. And again, that's another component that the FDA encourages, that you do have secondary screening set up where someone with a contact or contactless thermometer, preferably a healthcare professional that asks additional screening questions to validate whether you have a now fever or not as part of that secondary screening. Keep in mind, these are all adjunctive screening devices. So that secondary screening is an important component if you're going to take action on the results of the thermal imaging. So hopefully that helps answer that question, and hopefully put a little bit more to bed around, accuracy and what to be looking for. And again, aligning with the FDA components, because they've been able to identify FDA approved manufacturers in this space, and there's a reason for it.
Great, thank you. We've had our audience chime in with a question as it relates to thermal technology. And this is the question: with companies implementing thermal technologies, are there any that are standalone? First question. Second question, what other technologies can be incorporated so that a personnel is not needed to run these screenings? So more hands-off, less people. Any thoughts on that?
Yeah, great question. We get that a lot. So the first component is most of these systems are standalone, and there's two reasons for it. Primarily, one, that cameras are being repurposed from industries outside of the security space. So let's take FLIR, for example. They're handhelds, they're battery operated. They're not network devices, don't have the traditional RJ45 connection. They've got a USB-C out that we can then take to a monitor that puts people monitoring these systems at safe social distancing lengths. So that's one of the key components here, is most of these systems remain standalone simply as a product of how they've been built and how they're being purposed. Now, we are seeing some cameras come out that are following more of the security architecture now, where they can be a network device, where they could integrate with your systems. And the only concern I have there, and again, we're still waiting for some clarity, and this is a kind of a moving target for all organizations. So make sure HR and legal is within the conversation surrounding whether or not you record this information. Taking a live stream of temperature taking into a VMS so that you can view that in real time, that from what we understand is acceptable. But to then record that, if I can identify, hey, that's Kelly, and her temperature was elevated at whatever that temperature reading is, now the PII, potentially even those HIPAA concerns come into consideration as to whether or not you want to have to walk through that compliance and auditing component within your security systems now. So that's the only caution that I would have on that front.
All right, thank you.
And then the last thing, Kelly, you did mention the remote monitoring. So right. That's a little bit of a gray area, I would say. If you're going to follow FDA guidelines and have secondary screening, then that requirement would have somebody manning those systems, and then, you know, asking in a very kind of discreet or, you know, process-driven way to have an individual that's elevated in front of the thermal camera to go over to secondary screening. The concern of automating this or putting somebody at a distance where they're not in the lobby to take action is if somebody is elevated and now they access your facility and then eventually they're identified as COVID positive. Now you're going and back tracing, one, all that contact tracing concern, but also the process will be probably called into question why that individual, when elevated in one screening situation, that individual was not, you know, deterred from entering the facility or sent over to secondary screening for confirmation. So that's the only kind of risk I see associated with not manning these stations and not driving the process for screening appropriately.
Very good, thank you. Mike, how are your clients responding to the COVID-19 crisis right now, immediately, without thinking about the re-entry? What were things that they did immediately?
Well, I think the first thing most clients did early on was they assembled a team. And that team of individuals is very important because there are probably people that you've invited to that team today versus maybe 6 months ago that are different. And one of the key things is that obviously we have a lot of human resource issues that we have to deal with. We have a lot of privacy issues we have to deal with. So involvement from the HR team is very critical, and your legal team. Secondarily, your communications team within your organization or your building is also extremely important. And coming up with a very clear mechanism to be able to give information to the population of the facilities on a daily basis, exactly what's happening inside that environment. You as an organization are responsible for the OSHA duty of care as far as creating a safe workplace environment. And that safe workplace environment includes a lot of different aspects of your facility. It includes your cleaning crews. It includes your HVAC maintenance. It includes your guarding services and how they interact with your people. So there are a number of different people that need to be on that team to evaluate the policies and procedures you're creating and making sure that those policies and procedures don't violate any rules or regulations that have been set forth by the organizations that we've mentioned here on this webinar. The other thing is there are a number of different areas where you can go to get information. One of the ones that we'd like to point you to as an organization is if you go to convergint.com/COVID, you have the ability to look at all the information that Convergint has assembled over the course of the past couple of months. And this has been an evolving process for everyone, including Convergint. There are things that we posted back in March that we've revised multiple times based on new requirements, new regulations that have come out by the different AHJs. So I strongly recommend that as you develop your plans, utilize the resource that we've created in that convergint.com/COVID environment to help guide you through what is acceptable and what you should be thinking about as far as an organization as you re-enter your facilities.
Great, thank you. We have a question from the audience. Question is, what is the cost of all of these changes and how long would it take to install the parts? And I think probably that's a two-part answer, from installing a new system to one where, Mike, you talked about leveraging your current infrastructure to help you through this. So I don't know if you can really give somebody a cost not knowing more specifically what they're looking for.
Well, I think the first thing that you want to look at is, and you mentioned it, Kelly, leverage what you have existing. There are a lot of ads that we can incorporate into your current physical security infrastructure that don't cost a lot of money. The CERT program that Doug mentioned earlier for tracing, that program is free. The only thing it costs you as the building owner or the employer is to have us come in and set it up so that it communicates with your access control database, and we walk you through how you actually implement it or get those reports. So there are a lot of, I consider, low cost things that we can do with what you currently have that are going to help enhance your ability to be able to react to different things that come up in your building as you go through the re-entry process. And you have the ability in the beginning, because of occupancies being curtailed as far as the number of people you can have in there, you have the ability to test those in a smaller population and make sure that they work, so that as 30%, 50%, 90% occupancy comes back in your facility, you've perfected that. And as you go forward, as you look at other technologies that are out there, as Doug mentioned earlier, as you take a look at your own individual situation and the level of sophistication that you want to have, you can buy a thermal camera system that is upwards of $30,000, but there are other ones that are out there on the marketplace that are probably $3,000 or $5,000. It really comes down to, what are you really trying to accomplish as far as a level of accuracy to determine whether or not that technology is going to help you deter, as Doug mentioned, any people coming into your facility for work on a daily basis that may wind up having an elevated temperature, or using the screening process when they're at home before they come into the building, so that they're not getting on public transportation, they're not getting in cabs and Ubers to come to work, and you've basically taken the opportunity to assess their fit for duty on a daily basis while they're at home getting ready for the day. So those things can be very low cost that will make a big impact on the number of individuals you have coming to your building that are potentially infected on a daily basis.
Doug, do you have anything to add to that?
No, that sums it up well.
All right, so this would be a question for both of you gentlemen. What have you been asked to do most post-COVID-19 that's different from what you were asked pre-COVID-19? I'm going to go with thermal cameras first. Doug, I'll let you go first.
No, 100%. I have pretty much lived and breathed thermal cameras for the last 3 months nonstop. When I start dreaming about them, now I know there's a problem. So I think at this stage, the only thing I'll say coming out of that is that there needs to probably be just a little moment. I know that there's a ton of products in the market, and there's an incredible sense of urgency to continue to maintain workplace operations or bring people back to work. But I do kind of want to just stress, as a piggyback to that question about what's changed, we're rushing from an organization standpoint. It feels like we've put aside some of the technical validation and some of the process in identifying what your success criteria is as customers. And so, take a moment to just kind of like pause, reset before rushing to buy a particular product, because I can tell you there's a lot of stuff that's flooded the market that does not do what it claims, that does have limitations, that maybe doesn't follow FDA, IEC guidelines, which are really important to getting that accurate, consistent measurement. So that's been the biggest change, is there's a lot more rush to do something. And we're seeing some products get deployed that are not providing the outcome that the customer expected. And so that's an area that we can certainly help. We spend a lot of time researching a lot of products. We probably get 2 or 3 new products a day that come across our desk. And, I would just say, spend a little more time just asking questions of these manufacturers. Some of them have incorporated in the last 60 to 90 days. That should be a red flag. If they don't expose everything in a tech spec that you would expect to see, like, for example, if it's a tablet and it has a thermal camera incorporated into it, does it give you all the thermal camera information? We've seen some people withholding some of that information in their spec sheets. So just take an extra second. I know there's a lot going on, but take a look at that information, ask some good questions of manufacturers or people that have repurposed technology for this use case, to make sure that you're getting what you expect. And we've had the fortunate opportunity to test a lot of systems, and we're happy to provide that feedback as needed.
All right, thank you. Mike, what about you? What are your discussions around pre versus post?
Well, the first thing is, people usually ask me why my hair is so messy, but that's really doesn't concern their building. Obviously, operating in a virtual environment, it's completely different. But I think first, the thing that customers are most concerned about is making sure that whatever they are doing is in compliance with the rules and regulations that are out there. And Doug's mentioned a couple of them before, but the CDC guidelines, the EEOC guidelines, the OSHA guidelines, all of those websites are very, very good, so that an employer can go to those to get the information they need specifically for the type of facility they have. Because unfortunately, there's no unicorn in a one-size-fits-all for the different vertical markets that are out there. An office building that has a large number of people that come to work every day is very, very different than a manufacturing facility. It's different than a college campus or university. It's different than a hospital. So each individual vertical market has their own specific set of needs and things that they're looking to do on a daily basis to protect not only their buildings, but protect their people. And I think those resources have helped me personally be a better advisor to my customers by understanding what they're saying in those and how they apply to the specific facilities that are out there. And I really truly believe that the people that I've talked to that have taken the time to develop a solid team that could include consultants that they've used in the past in the overall implementation of their buildings, getting people that know the systems and how they operate, and maybe uncover things that are in those systems that they don't even know about or don't even know that they exist. One customer asked me the ability, in their visitor management system, they wanted to be able to track phone numbers of all the people that were coming in the building, so that in the event they felt that that person was infected by somebody that was in the building, they had the ability to go back and contact them. And it was very simple. All they had to do is create another field within their visitor management system that the question they asked the individual when they came to the building is, what's your phone number? And that's something simple that they've already paid for. It was there. The customer just didn't know how to implement it. So use the resources that you have in people like Convergint, other integrators that you use, or even your consultants that are out there to try to help you navigate through the systems and what they can potentially do to help you without spending a lot of money.
One of the items that we haven't actually touched on here, which has been a topic of conversation for me with some of my clients, is frictionless entry. We've actually gone to a site and removed biometrics and keypad readers. So any information on frictionless? I mean, I think that's probably maybe a little longer term implementation, but it is something to think about.
Absolutely. Facial recognition is a way that we can, reduce the amount of things being touched, but still provide that dual factor authentication. There are some companies that we partner with to achieve that outcome. I guess one other interesting technology, and I guess, we're just preparing to kind of bring this to market, so it's kind of a high level teaser on it, but we're working with a company that can provide an all-in-one credential, and it can help achieve actually some really interesting COVID related capabilities. For example, remote workers, if they've got their credential in hand, well, what's interesting, it's got a fingerprint reader built into the card itself. And that fingerprint reader allows the individual holding it to have to verify their identity before they use the card. So if you lose your card now, it won't allow you access into any facility, onto your computer, anything along those lines. The other interesting thing, and I mentioned it earlier, but it also includes UHF technology. So if you wanted to do that contact tracing and social distancing and monitor more for safety purposes where people are within the facility, these cards would achieve that capability with some other devices that would have to be placed around the facility. But really interesting, again, kind of that touchless technology concept. So now credentials, the fingerprint reader, instead of people, as you mentioned, Kelly, having to touch a bunch of devices or do keypads, provides that dual factor authentication within one component, right? And it's a lower cost option as well. So something that we're excited about, that we're just preparing and looking at third-party apps that we want to utilize and integrate to make this technology work in a variety of capacities. So more to come on that in the coming weeks.
Very good, exciting stuff. Thank you, Doug. And lastly, any input that anybody has on budgets? If we could give a little bit of flair to our audience so that they don't feel like they're the only ones that maybe are getting their budget cut. What are we seeing out there when it comes to security budgets in this COVID era? Mike, I'll let you go first.
Well, I think everybody from a budgetary perspective is somewhat constrained at this point because of the slowdown in their overall business. But then there are other customers that are out there that have been going gangbusters during this time based on the people staying at home and using different technologies, things like that. I think every piece of technology that you're looking at today really needs to follow the policy and procedure that you have, and also increase the overall productivity that you have. Just by installing a thermal camera system in the beginning, in the entryway to your building, you may wind up slowing everything down. There could be other ways that you can accomplish the exact same thing, but not have that decrease in the overall productivity as far as getting your people in the buildings. Most customers that I've talked to, they've been given the ability to be able to purchase those technologies that truly marry up with what they need to reopen a facility safely. I haven't seen a significant reduction other than the fact that I think people are being more cautious, as Doug mentioned, to make sure they don't buy some technology that doesn't work. And when this whole COVID thing is over, they're just throwing it in the closet and never using it again. Try to incorporate things that are going to be there for the long term, and they're going to help you not only today, but they'll help you in the future.
Very good. Thank you. We're nearing our hour limit on the webinar. So in closing, I would like to say that it is our hope that we've provided you today with some lively discussion, some tools, technologies, and some food for thought that you can take back to your organization for implementation. Of course, any kind of re-entry needs to be in step with local and state parameters. If there's information that you would like to look at from this webinar, you can go to convergint.com, or you can contact your local account executive. And please know that all of us here at Convergint wish you success in the Great Reentry. Thanks for your attendance today.